So generally, still the surgery is the most curative way for melanoma. We have to stress it. So generally, without surgery, we haven't almost cured any patient, except the patient with metastatic disease where we use immunotherapy. Maybe in some percentage of patients, we can tell that they are cured with immunotherapy. But for early melanoma, of course, surgery, this is number one. This is what maybe we will limit in the future, taking into account all these adjuvant or perioperative therapies in melanoma. Maybe we'll also limit the extent of wide local excision, and only R0 resection without any specific margins will be enough for primary melanoma. But we need more data. This is first step. Second step, of course, is partly eliminating maybe sentinel biopsy based on this genetic profiling of the primary tumor. And the third step is, of course, what I mentioned is omitting of therapeutic lymph node dissection with preoperative therapy and looking only at one specific lymph node. So we all a little bit going in the direction of the breast cancer, but still there are completely different diseases, because melanoma is one of the best treatable disease with immunotherapy. But if we would have only the very early melanoma, PT1A or in situ, so we'll not tell anything about the further surgery, because these patients needs only the local excision, and that's all. So also the prevention is important.